Okay, so I'll start off. Good evening, everyone. Welcome to the second workshop of ISTE's BizFest. I'm your host, Rohan Sunil. Today, it's our privilege to welcome our guest, Ms. Radhika Batra. Ms. Radhika is the founder and president of Every Infant Matters, a non-profit organization dedicated to improving the lives of disadvantaged children in India, and she's also the ambassador of One Young Child. She's a doctor by profession with an MD in pediatrics. She is the senior resident pediatrician at ESIC. Also, in 2020, she was nominated for the world-renowned Forbes 30 Under 30 for social entrepreneurs. Thank you for accepting our invitation, ma'am. It's great to have you here with us. We hope you're all doing well. So, to start off, could you please tell us about your experience of the COVID pandemic on you personally, professionally, and on your organization?
Hi, thank you so much for having me here, and it's an honor to speak to students of NIT and to be able to let them know what I have been doing and hopefully be able to inspire them to start their own venture. I hope I'm audible and I hope my voice is clear.
Yes, ma'am.
All right. So, coming to who I am and what I do, as I was very nicely introduced, I am a pediatrician, I am a social entrepreneur. And what I have been doing is I have been working in pediatrics, and I also have been working for the poor with my nonprofit. And once the pandemic started, being a frontline worker, being a philanthropist, being someone who cares very deeply for those who are badly affected by things, it affected me on many levels. Be it personal, be it professional, be it my family. So, to start with, I think personally, it was a very, very frightening experience because when the pandemic started, we had no idea what the disease was about. We had no idea how it spreads. We had no idea who it affects. We had no idea about anything. The best doctors in the universe had no idea. And there was just one thought in my mind that, what if I get it in the hospital, which was very likely back then, which is very likely even now. But, what if I get it and what if I come home and I give it to my parents and, something happens to them? This was my biggest fear back then. Even now, it is a very big fear. Of course, touch wood, now they are vaccinated. Now I am vaccinated. So slightly that fear has been alleviated. But it was a gut wrenching feeling, because you can't live with this feeling of having done something bad to your loved ones, even though unknowingly. But it was just very frightening for me as a person. When it came to work as a pediatrician, everything changed. All of a sudden, being a doctor was not about treating patients. It was about a lot of other things. It was about saving your own skin for starters, because if you don't survive, if you are not well, you cannot fix patients. So you had to protect yourself. And that was something which, as doctors, we had always, never really focused on our own well-being. We had always dealt with scary diseases, with HIV, with tuberculosis. We had always dealt with infectious diseases, but somehow we never really cared about getting it because we always knew we would get it. Now suddenly the threat was to our family and our loved ones as well. So suddenly the whole dynamics changed, in a way. So that was about the medicine side of it. Now coming to the non-profit side of it, when the pandemic started, I felt and the others in my organization felt that we must do something to help those who are the worst affected. Specifically after the great Indian lockdown happened exactly a year ago, we realized that a lot of people are dying. More people are dying of hunger than they are dying of the COVID-19 pandemic. So we decided to fight this problem of hunger. And for starters, what we did was we distributed this COVID care kit in which we gave 20 kgs rice, 20 kgs atta, spices, oil, salt, and we also gave a bar of soap. So we gave this groceries and essential care kit to a lot of daily wagers, migrant workers all over the country. And then once we got a lot of funding from international sources, we had applied for this COVID-19 Young Leaders Fund. So with God's grace, we won that grant, and we were able to help a lot of people with that money, and we were able to help a lot of people in Nigeria and Kenya with that money, and also in the Dominican Republic. So overall, our modus operandi was that we have to help those who are the worst affected. So one segment is, of course, the poor people who are out of jobs, who were starving to death. And the other segment was the health workers. And, you know, being from the fraternity myself, I used to see every day how much health workers are suffering. And more than doctors, I felt like the sanitation workers in the hospital, the ambulance staff, the kitchen staff, you know, those people are at as much risk as us, or even more risk than us, because they are dealing with medical waste, and they were not able to get proper protective equipment. They were not able to get a lot of sanitizers, and even if they got for themselves from the government, from the hospital, they didn't have enough for their families. So we started distributing personal protective equipment in the form of PPE kits, face shields, sanitizers, you know, a lot of stuff. We gave N95 masks, 3-ply masks, everything we distributed to the essential workers, be it hospital workers, be it the police personnel. You know, all this we did throughout the pandemic. And it was only, you know, around in October, November, when we felt that the pandemic is sort of lessening now. After Diwali, I would say around Diwali it was the peak in Delhi, and after that it sort of, you know, lessened a bit. So only then we relaxed COVID-19 relief activities. We're still doing a lot of food relief for the poor people, because I don't know whether you've read, but there was a recent report which said that the pandemic has forced almost 35 million Indians out of the middle class into the, you know, the poverty class. So that's what we have been doing in the pandemic. I hope that sums it up.
Yeah, it's great to hear that you've taken so many steps. So, speaking about your organization, what kindled the entrepreneurial spirit in you, ma'am? What was the key driving force that made you become an entrepreneur?
Yeah, so this is a very interesting question, and you know, I think all the talks and all the places where I speak, they always ask me this question, and I always try to frame it a little differently so that it doesn't sound repetitive. But you know, the gist of the matter is that when I started work in pediatrics, I saw children dying every day. And if 10 children had to die in a day, at least 8 were deaths that we could have prevented had there been a simple, timely, cost effective intervention done on time. Be it a vaccine, be it a medicine, be it timely referral to a tertiary care center where a ventilator is available, be it something as simple as money to buy medication. So this was something which affected me on a very personal level, that, you know, why are these children dying? And as much as you try to help them, ठीक है, आप दो patients को, you can try to help them with money, you can try to help 3-4 with money. You cannot go around giving your own savings and your salary to every patient, every child who is in need. So this was something that I wanted to change, that we have to have a model where there is ubiquitous access to healthcare, irregardless of a person's ability to pay, irregardless of their socio-economic background, their religion, their gender, anything. No child should be allowed to die, specifically if we can prevent it. And even, no child should be allowed to get disabled or permanently blind, specifically if we can prevent it. So this is what we were trying to do, and this is what was the driving spirit behind my starting Every Infant Matters, that I want to change this injustice, I want to fight this injustice that the kids of the world are facing, and I want to make sure that nobody dies or becomes irreversibly blind or disabled because of a preventable cause. So this was what drove me to start Every Infant Matters. And of course, we started off on a very small scale in one city with one flagship program. We're still doing that flagship program, but we've scaled it a long way, and now we are in 4 countries across 3 continents. So that's how I was, motivated.
That's very good to hear. Great to hear that, ma'am. So, based on your experience, could you guide us, the students, on how to become a self-starter and the path you follow to become successful? Like, what are some of the key skills one would need technically in order to become a successful entrepreneur?
Hi, could you just repeat the question? I'm so sorry. There's some disturbance at my end, so I missed it.
Yeah, sure, ma'am. So, based on your experience, ma'am, could you guide us on how to become a self-starter? So, basically, the students and the path followed you to become successful. And what would you say some of the key skills that are required in order to develop into a successful entrepreneur?
So, what I personally feel, there are a lot of skills which everybody would say, okay, you have to be smart, you have to be intelligent, you have to be this, you have to be that. But what I personally feel, the single most important factor, I'm so sorry, Kunal, there's a lot of disturbance at my end. Can you hear me?
Yeah, we can hear you, ma'am. No
You
problem.
can hear me. All right, I'm so sorry. Okay, so what I was trying to say was that, the single most important factor for being successful, specifically as an entrepreneur, is to have drive and to have passion about what you're picking as your area of focus. It could be anything. It could be technology. It could be non-profit venture. It could be car, salesmanship. It could be anything. Whatever you feel strongly about, you should only pick that. Tomorrow I could feel strongly about baking cakes, and if I feel very very happy baking cakes, if I feel like that is my calling, I want to feed the world with really amazing delicious cakes, that's what I should do. But if I pick up something which I'm only half interested in, suppose I pick up, like for me, if I pick up something like finance, finance is not my thing, it's not my area, it's not something I feel strongly about, then I'll never be successful at it, however much I try, because it will not drive me from within to change anything which is already existing in that system. And what makes for a successful entrepreneur is to do something new, something exciting, something which the world has not seen before. And that is what makes for a, that's what your USP is. You know what USP means, right? Unique selling point. So you have to have a USP, and that USP you can only find when you're very very focused, driven on a particular cause. Like I have friends who come and tell me, that we are very passionate about mentoring students. So that's what I say, then why don't you do it? You have the time in your schedule. You pick up area. You just pick up any student, who you feel like needs help, and you start from there and you take it forward. It doesn't have to be a company. It doesn't have to be a very huge venture. Change starts from a single person being motivated to do something, and that is what makes for a successful entrepreneur, according to me.
That's very insightful, ma'am. I'm sure the students would have learned something from that. So, I'm sure you would have faced some hurdles while coming up, building up your company. And so, what would you say were some of the challenges you faced, especially as a woman in the process of building up your company? And what steps did you take in order to face these challenges?
See, the first thing which I'll tell you is, and this is something which women face more than men, that the minute you try to deviate from that, being an Indian woman, being a, having Indian parents, I think all of us can relate to that, that the minute we try to deviate from the path that is set out for us, कि आपको पहले कॉलेज जाना है, फिर आपको जॉब करना है, फिर आपको शादी करनी है, फिर आपको बच्चे करने हैं, अगर आप उससे जरा सा भी हटते हो, तो you are faced with massive resistance from within your own family. And this is more true for women, where you have societal barriers, where you have shackles of patriarchy, where we are told that if you're not married by 30, it's a very big problem. If you don't have your first kid by 30, then your biological clock is ticking. So of course I had to hear these things as well, and I just didn't have to hear them once. I had to hear them time and again from my, initially from, of course, from my parents as well, but after that from my extended family, from family, friends, from relatives. You know how Indian relatives are. So this was something which was very demoralizing in the beginning, and it did affect me. It did affect me that I am 27 and 28 and I'm not married, and I'm focusing on things other than my marriage and my family. It did affect me in the beginning. It affected me on a personal level. It affected my work. But the only way to to get over these problems and to get over these comments is by telling yourself that everybody is doing what is set out, what this normal path is. But if you're deviating from the normal, and you end up in the process, you end up saving 54,000 children from blindness, then who is being the the bigger person here? Okay, if I want, I can get married tomorrow, but I don't want to. I want to focus on these things. It's a choice. And how if I think all of you would have read Harry Potter. I used to read it a lot. And there was this one time where Albus Dumbledore says, it is your choices that define you, Harry, far more than your abilities. So ultimately, it's about the choice that you make. And if the choice that you make is a little different from the others are making, don't be afraid and stick to your determination. Have that grit, have that enthusiasm, and have that confidence, and have that faith in yourself that yes, I am on the right path, and I don't need to follow trends of the world. I need to be a trendsetter myself and make my own trends. So that's one of the major problems I faced being a woman in India, being a woman in Delhi, being a female doctor, female entrepreneur. There's a lot of there's a lot of misogyny in the world, where people see that you're a female, and they immediately think that ये तो लड़की है, ये क्या कर लेगी. This is the kind of mentality that a lot of Indian men specifically have had. So this is something which as an individual, I'm trying to change, and I'm trying to encourage the women around me to feel the same way as I feel, and I want them to stand up to these patriarchal norms and make a difference in the society. So this is one of the major problems that I think all the female entrepreneurs, all the females, and I think youngsters, even boys, would face this resistance from their family. The minute they say कि नहीं हमें job नहीं करना college के बाद, हमें कुछ अपना start करना है. ठीक है, I am not saying कि आप एकदम ही don't completely just do something if you're in need of financial backup, if you're in need of a good solid support system. Don't just jump into entrepreneurship. Earn a little bit of money first, spend a few years making yourself strong financially, and then jump into entrepreneurship. Find investors, find people to back you, and don't take very unnecessary risks. Take calculated risks which may or may not pay off in the future. So that is what I would suggest.
Very well said. Very well said. Okay. So going back to entrepreneurship, being one of the founders of one of the fastest growing social organizations of India, how did you find this as your interest or domain of interest? Sorry.
So like I said, that it was affecting me on a very personal level, that kids were dying. But what was affecting me even more was, even if they were surviving, they were not living a wholesome life, because they were going blind because of something as trivial as as curable and as preventable as vitamin A deficiency. Like vitamin A is something that you and we get from our food. Like, we have milk, we have eggs, we have butter, we have non-veg in our diet, we have good food in our diet, and we get vitamin A, we get all the essential fat-soluble vitamins from the food, and we don't have a problem of malnutrition, and we don't have to face the deleterious consequences of malnutrition, and that is why we don't have to suffer from these, from this blindness. So what happens is that if you don't have enough vitamin A in your body, which all of these malnourished children don't have, like you see children on the streets, you see children in the slums, you see children in villages who have that goldenish tinge to their hair. They're very thin. You can see their bones. You can see that they're not in a very good condition of health. So what happens is that because of reduced vitamin A in their system, they initially have loss of vision. They have night blindness, and that ultimately proceeds to irreversible blindness if it's left untreated. And this was something which I really just couldn't take, as a person with almost like a person with normal sight. That's what I do, wear glasses, but I can see with the glasses, right? And I just felt like, why do I have this privilege, and why do these children do not have this privilege? Specifically when it costs less than the price of a hamburger. It costs less than $2 to treat a child of vitamin A deficiency. So why should we not do it? And this is what inspired me. This is what drove me. And this is how I started with Every Infant Matters flagship program, which is giving vitamin A to prevent irreversible blindness. And like I told you, 54,000 children till date in India, Nigeria have been given vitamin A to prevent them from going blind. So this is something which we've accomplished, and this is something we plan to scale to 3-4 more countries in the coming years. So let's see. Let's hope that works out.
That's really awesome to hear. Also, so it's a great achievement to have been nominated for the Forbes 30 under 30. I'm sure it was one of the wow moments in your life. So could you please describe it for us? Like, how has this achievement changed your outlook personally and for your organization?
So, Forbes 30 under 30 is something that I think all of us youngsters, dream of. Like even I used to dream कि एक दिन मुझे Forbes 30 under 30 की list में होना है. And then I just used it as a driving force. accolades are great, certificates are great, having your name in Forbes magazine is great, but nothing is as great as knowing that you impacted someone's life. So all of these accolades are nothing but a driving force. Okay, if it can give you a slight motivation to work harder, to be better, to do better for these children, then why not? And that is what I consider this Forbes under 30 as my motivation, as my drive to be better, to do better. And then ultimately what happened, I was nominated, I cleared the first round, after which there was an extensive interview process by Roshni Nader, if you've heard of her, and 2-3 more judges. So there was this extensive interview process, and I think then after that they selected 30 of us to be on that list. And I think after that, what really changed for me as a person and for us as an organization was that we got that Forbes ka thappa of approval. You know, it's just a validation that if Forbes has recognized this entrepreneur, this company, then it must be doing good work. So it's a validation of everything that we did, and that really felt good because that opened a plethora of opportunities for us. It just gave us a lot more to do, a lot more of recognition, a lot more. Our name was famous in the circles of Asia and in the circles of the world, and the more you are heard, the more your voice is heard in this world, the more traction you get, and the more ultimately it's all a ripple effect, and it all trickles down to the fact that more children are helped and more lives are impacted with these things. So ultimately, it was a very good thing for an organization to have been mentioned in Forbes Asia of 2020 last year. So yeah, that's what the journey was about. And after that, of course, we got a lot of opportunities for collaborations, for funding, for this, for that. And that was really great for us because ultimately it all translated into more children being helped and more poor being impacted and helped in our venture.
It's a really great accomplishment, ma'am. Congratulations.
Thank you.
So that's very great to hear. So now I have a question which you've probably been asked multiple times over the years, and I think our viewers will be eager to hear this. So I'm sure that you've drawn your inspiration and sought guidance from someone. Who is your role model, ma'am?
So my role model, okay, first of all, no one has ever asked me this question, so thank you for asking, and I'd love to speak about this. So I think my role models are both my parents. There are two role models, and my father, because I got the motivation to be a doctor from my father, and I got the motivation to be a philanthropist from my mother. And when we were younger, like when I was a child, we used to stop at accident sites and we used to help victims reach the hospital because my father is a very good doctor. That's what, he's one of the best doctors in the world. And he's just so passionate about patient care. He's just so, it's just, you can see how much he cares about his patients. And that's what I wanted to be. That's what I wanted to be when I grew up. I wanted to be a doctor. I wanted to care about people the way he cares about people. And I wanted to have that power of healing. If, tomorrow I go to a restaurant and God forbid somebody is dying in front of me or somebody has a heart attack in front of me, I should be able to have that power to help that person till they get to the hospital. Like once I remember I was a child and we had gone for swimming and somebody drowned in the pool. My father helped that person come out, and my father gave him CPR on the spot and saved his life. So that's where the motivation and the drive to become a doctor came from. And my mother, was into charity work since the beginning. She's a gynecologist, she's an OBGYN surgeon. She used to operate on poor patients for free, for the longest of times. People who couldn't afford high-risk surgeries, she used to cut her fees, she used to do it all for free. She used to operate for three hours without charging any money. And, that's where I realized that, I need to help the poor as well. And then she started her own organization back in 2005, I think. And they were one of the, largest TB treating organizations in the world. But of course, there was some problem with that organization and it ultimately didn't really pan out for her. But now what she's done is she's joined Every Infant Matters full time, and she's focused on helping me develop my organization. And my mother is one of the strongest ladies I have ever known. Her grit, her determination, her drive to help the poor is what has inspired me to do the same. So I would say both my parents are my role models, and that's where I get all my inspiration from. That's where I get all my qualities from. That's where I've learned everything from, be it being a doctor, being an entrepreneur, everything that I am today, I am because of my parents. So there could be no better role model for me. Yeah.
That's really inspirational to hear, ma'am. Okay, so you have worked in various global positions. What is your key takeaway from this experience, and what is your guidance for the students on working globally in different multicultural environments?
So I think, when you're working globally in multicultural environments, you're meeting people from Kenya, from Nigeria, from South America, from North America. There is always something that ties all of us together, and that is a drive to help people in our area. And, when you converse with these people, you get to know of problems that you can never dream have existed in this world, because you are so, you're sitting comfortably in your home. You have no idea what the girls in Kenya in the slums are facing. I'll give you an example. Like in the lockdown, I was speaking to my partners in Kenya, and they told me that the poverty has gone so from bad to worse in the Kenyan slums, that girls are having to, indulge in sexual activities to get money for essentials like sanitary napkins and Wi-Fi for their education. So these are, these are shocking and these are eye-opening. And this is something, living in India, living in Delhi, living in the safety of my own house, I could never have dreamt of. So when you are in a global networking position, be sure to understand the problems that the others are facing in their area. And there's always something that you can learn from them, and there's always something that they can learn from you. So it has to be a sort of a synergistic relationship where we are both helping, where we are all helping each other ultimately towards, one goal, that we have to make the world a better place. We have to work with each other, and we have to, build a model where we are all being, it's like about each one teach one, where the people in Kenya are telling me ki, ma'am, we have a particular model going on which we feel like the kids in India would benefit with. And I can say that, I have a sanitary napkin distribution drive going on which these girls in Kenya would benefit in. So, ultimately when you're in this space, you have to set aside your ego and your personal selfish gains wala mentality. Right? You can't think कि, मेरे को क्या फायदा होगा वो कीनिया में girls को help करके. You have to think of a very you have to have a very broad mind when you're networking in these global positions. So that's how I feel like the world will progress if we all come together and we work towards a common goal of making the world a better place, of attaining the SDGs by 2030. SDGs are Sustainable Development Goals, which have been set out by the United Nations, and we're all looking to achieve them by 2030. And the only way we can do it is by coming together across different geographies, breaking the socio-cultural, language, and geographical barriers, and coming together as one whole entity working towards this common goal. So that's what I feel is a good idea.
Those are some great points made, ma'am, and that's also some good advice for the students who are listening.
Okay, yeah, of course. And if there's any particular point that the students need advice on, just share my LinkedIn, and anybody who wants can always reach out, and I'd be happy to help them in any personal interaction if they'd like it.
Sure, ma'am, sure. And one question, what are the future plans and goals with your business, and what steps are you taking in order to expand the business, ma'am?
So for Every Infant Matters, we have a couple of set goals for the coming year. One, of course, is that we want to expand to at least 4 more countries. We're already in talks with Yemen, Rwanda, with Haiti, with Mexico. So we're hoping, because these are all countries which have a lot of poverty, which have a lot of malnutrition, and we really want to reach to these areas and help these children as much as possible. That is one. Secondly, we want to develop a technology aspect of our work, which is where I think engineers can help me a lot. And we're looking to build an Android app which helps to screen high-risk children and get them to the hospital on time. That is one of the apps we're looking at building. It's in talks. We're looking for funding, and it's going on. So these are some of the goals. Of course, thirdly, we want to become a financially sustainable model, which we're not right now, and we will be sooner or later. But right now we're not, and we're working on that as well. So these are our goals for the future. And ultimately, like I said, it's all about one day reaching a point where no child has to die or become disabled for reasons that we can prevent. There are things in life that we can't prevent. There's Down syndrome, there's cancer. There's nothing that I can do for those children. But there's a lot that I can do for the children who are malnourished. It's just food after all, it's just food. Food is something all of us take for granted, and these children don't have it. And, that just breaks my heart. So that's what we're looking at ultimately with Every Infant Matters.
So we wish you all the very best for your future endeavors.
Thank you so much.
So moving on, I'm sure the audience has some questions they would like to ask you, ma'am.
Yeah, of course.
So the first question is, ma'am, what are your thoughts on starting up in college? What would you say are the top 3 skills needed to be a successful entrepreneur? I'm sure you've already covered a little bit of this.
So like I said, the topmost skill, of course, is to have that passion and the drive for whatever you're picking as your area of focus. Because unless you have that passion in you, you won't be motivated. You won't get up early morning and say, okay, aaj mujhe ye karna hai. It's not going to come from within. Second, of course, is you need to have a strong, level-headed thinking where, you can't let your emotions get the better of you. And this is one of the problems I have faced, because being a very emotional person, I often tend to get carried away. But like I said, you have to have that level-headedness about you, that you can't take undue, unwanted, unnecessary risks with your savings and, ultimately with your life. So you have to have a very balanced and pragmatic kind of approach. So that is the second. And the third, of course, what I personally feel is that it's important to have a very good support system, be it your friends, be it your family. Like I am, touchwood, I am blessed that way. I have the best support system in the universe, with my friends being the best that they could be, with my parents being amazing. So, if you have that support system around you, you will have something to fall back on the bad days. There are going to be, as an entrepreneur, you're going to have good days, you're going to have bad days. There are going to be failures, there are going to be successes. So, it's very easy to let the failures get the better of you. It's very easy to let those downs affect you in a way that it's difficult to come up again. And that's where your support system really helps you, really motivates you to stand up on your feet once again. So technically it's not a skill, it's more of I would say, okay, maybe it is a skill. Making friends is also a skill, and having good interpersonal relationships with those friends, maintaining those friendships, is a very big skill. It's very easy to make friends, it's not easy to maintain those friendships. So I think, yeah, maintenance of interpersonal human relationships is a very big skill required for entrepreneurs, according to me.
Yes, very great points made. Another question we have is, how did you advertise your business in the early stages?
So us being a non-profit venture, we didn't really need to advertise, but like I told you earlier, we need traction, we need branding, we need to get our voice heard in the global spaces, and only then can we progress as a global non-profit organization. And the way to do that, the way we did it, was that I personally wrote a lot about my work. I think writing is one of my stronger points. At that time, public speaking was not. Now, of course, over the years, I've gotten better at it. But at that time, I used to be very nervous speaking in public. So that time, writing was something I did a lot. And I wrote for a few international platforms. My articles were published across 31 countries. So, that gave us a lot of traction. Then, one thing leads to the other. People in Luxembourg read my article and they called me to speak at a conference in Paris. People in Paris heard me and invited me to, X number of other events. So that's how things spread. Then I attended a lot of youth conferences. I was a member of many youth networks, global youth networks, which is how I did my networking and established my work in other countries. So that is how, we did our branding, and that's how we established ourselves as a global non-profit. And after our projects were established in Nigeria, after that we had a lot of traction. So that's how we did it.
Okay. Okay, we have another question. What business-related book has inspired you the most, ma'am?
Business related books. So I'm from a medical background. I haven't read many business related books, but a few books that I would recommend would be The Accidental Billionaires. That's the one by Mark Zuckerberg. Mark Zuckerberg's story, basically. It talks about how partnerships can also go wrong, and it's got a quite a few learning points. Then a few other good books which I feel are good for people to have a good, well-rounded personality. One of them is Man's Search for Meaning. Another one is The Catcher in the Rye. Then let me think, what else? So I feel like the Harry Potter series has a lot of lessons to give to youngsters. The first and foremost being that if you have good friends in life, you can get away with anything. You can achieve anything if you have that support system in your life. So I feel like that is also a good book, to good series to have read. Then what else? Let me think. I think that's all I can think of right now. If
Yes,
I
ma'am.
think of something, I'll ping you.
Sure,
And
ma'am. Sure. Those are some great recommendations of yours.
yeah.
Okay. Uh, how do you think one can set up a self-sustaining startup aimed at social causes, like you have done?
I didn't get it. What? Self-sustaining startup?
How do you think one can set up a self-sustaining startup aimed only at social causes?
See, self-sustaining startup. Oh, mine is also not a self-sustaining startup, just FYI. We're still struggling with being financially sustainable.
Oh,
So we are a donor-based model. See, there are different ways to make a NGO sustainable. There are people who, like suppose they're working with a community of women, they get the women to make certain items like scarves or some art, and they sell that, and then they get money to run their organization. And second is, of course, a donor-based model like what I'm doing, and we are completely dependent on our donors. Our beneficiaries are the poorest of the poor. We cannot even ask them to, create even a tinka for us. Right, so that is our model. Third is a hybrid model, which I feel is useful for those of you who want to start off new, and that is where you have two aspects to your company. One is for profit and one is non-profit, and the for profit aspect funds the non-profit aspect. So I think for beginners that's a good way to go. And if you can have a certain for-profit element, proceeds of which you're putting into the non-profit element of your work, then that's a good idea for beginners.
that's great, Manoj. Just a minute. Still seeing if more questions are there. Yeah, we have another question. How do you think social entrepreneurship can be converted into a full-time job for someone?
Yeah, see, it is a full-time job, but it takes a long time for it to become a full-time paid job. So there's a difference. So, for instance, at this moment right now in life, I have two full-time jobs. One is my job with the government, with the SIC, which is what earns me my living, and one is my job with the non-profit, which is also a full-time job, but it doesn't get me any money. And I don't see it getting me any money anytime in the future. It is just something which I do because it gives me a lot of satisfaction. It gives me a sense of fulfillment to have impacted so many lives. So to actually make a living out of being a social entrepreneur would be a very long drawn process. And of course, if you can have a hybrid model where you have a for profit and a non-profit venture, that would be the best way to go about it, and that would be the best way to earn yourself a little salary on the side as well. But with non-profits, it's very, very important to have a good legal and financial support system ongoing for you. Like that way I am very blessed. I have a very good legal head, a very good financial head, and they make sure that we don't enter be like because we're doctors, we don't have any idea of legal and finance. So it's very easy for us to make mistakes, and we don't want to do that. So we have our lawyers and our financial experts checking everything that we do, every smallest of things. So I would advise that to all of you listening, that if you're starting something, have your lawyer friends in the loop, have your CA friends in the loop, run every single transaction by them, and make sure you're not going against any of the policies of the government, because that is very important in the non-profit sector. You cannot even make the slightest of mistakes.
Yes, Sam, some very great points you've made.
Any other questions?
No, ma'am, I think that's it for now.
All right.
So, with that, we come to the end of today's workshop. Thank you, ma'am, for your insights on your very inspiring entrepreneurial path. And thank you for taking the time out of your day to make this happen.
No, the
By,
honor
share,
was completely mine. Thank you so much for having me.
by sharing your journey with our listeners, I'm sure you've inspired many in and around NITK
I
who
hope
wish to
so.
have
I
their own
hope so.
startup.
And
I'm
do encourage them to reach out if they have any questions, if they have any doubts, if they want any mentorship of any kind. I'm always available on LinkedIn. So feel free to reach out.
sure, ma'am. And once again, we wish you the very best for your journey.
Thank
Thank you,
you.
ma'am.
Thank you so much. Bye bye.
I would also like to thank our viewers. I hope you took something valuable